Good afternoon and welcome to the Women Veteran Teletown Hall. We will begin shortly. It does take a few minutes for our veterans to be called and connected, so until then, we want to provide some updates as we wait for everyone to join. Receive the most current updates from Madison VA by signing up for email updates. Go to our main Madison VA hospital website, scroll to the bottom of the page, and subscribe to Madison VA Healthcare News and Announcements. You can sign up for all our Madison distribution lists. We also encourage you to follow our Facebook page, where we routinely provide local updates and spotlights on veterans and employees. You don't need to create an account to view our stories. If you haven't received a flu vaccine but would like to, the walk-in table at the main hospital is no longer there, but you can still stop by the Lake Clinic Monday through Friday, 8 a.m. to 3 p.m. Again, that's Lake Clinic Monday through Friday between 8 a.m. and 3 p.m., or you can receive one at your scheduled appointment. Good afternoon and welcome to the Madison VA Women Veteran Teletown Hall. We will begin shortly. If you are new to the Madison VA Hospital and Clinics or need a refresher on VA services you earned, we offer a virtual new patient orientation on the fourth Monday every month from 10 a.m. to 11:30 a.m. Join us to get an overview of VA healthcare services with a question and answer session at the end. You'll learn how to receive urgent and/or emergency care, 24-hour telephone care, how and when to contact your primary care team, the best ways to refill prescriptions, promoting health and preventing disease, mental health, women's health, and specialty care services, how to request travel pay, and much more. We contact new patients to receive an invitation, but everyone is welcome to join us on the fourth Monday every month from 10 a.m. to 11:30 a.m. If you're interested in learning more, we have information and links to join the orientation on our Madison website. Go to the main Madison VA page on the left margin, click Events, and you can see when our upcoming orientations are and find the link to join. As a reminder, we'll be covering lots of information today and providing several resources, including phone numbers and website links. It may be helpful for you to have a pen and paper close by to write down those resources. Good afternoon and welcome to the Madison VA's live Teletown Hall. Our leadership is excited to connect with women veterans today. My name is Tammy Town and I serve as the Women Veterans Program Manager here at the Madison VA. I'll be moderating this afternoon's call. Thank you so much for taking the time to join us. We have a panel of Madison VA leadership on the line along with staff from mental health, whole health, community care, primary care, and several other areas to help answer your questions. Over the next hour, we'll share important updates, including fertility and menopause resources, our own Fisher House, the Strength and Recovery Program, advanced care planning groups, and more. Between these updates, we'll hold live question and answer sessions. If you'd like to ask a question, simply press 0 on your phone at any time. A staff screener will take your question and place you in queue to speak with our panel. We encourage you to stay on the line and participate. If we don't get to your question during the call, you'll have an opportunity to leave us a voicemail at the end so we can follow up with you. Please note, if for some reason you can't stay for the whole call, we'll also post this call on our website over the next week or two. Now I'll turn over the call to our Executive Director, Christine Kleckner, for opening comments.
We are thrilled to have you join us this evening for our Teletown Hall. We have several exciting updates to share, and I'm looking forward to hearing your questions and feedback. Women veterans belong at VA, the largest and only healthcare system designed specifically for you. We understand your unique needs and experiences, and we are committed to providing a safe, respectful, and welcoming environment for your care. Our approach focuses on the whole veteran, offering personalized support that honors what matters most to you. When you enroll with VA, you gain access to care designed to support your physical, emotional, social, and mental well-being at every age and stage of life. Thank you again for joining us today. I look forward to your questions and the opportunity to connect with you.
Thank you, Director. Next, we have updates from several of our programs. Our first update is on fertility care. Did you know that all veterans are automatically eligible for VA infertility benefits? That's right. If you've ever wondered about fertility care, VA has resources for you. Here's how it works. VA offers some basic testing, but most fertility care is provided through an in-network fertility clinic in the community. To get started, all you need to do is talk with your VA primary care provider and ask for a community care referral. These benefits cover a lot: your initial consultation, comprehensive testing like labs and imaging, procedures, medications, and certain treatment options. And here's something important. If a service-connected disability is the cause of infertility, you and your legal spouse may be eligible for in vitro fertilization and cryopreservation storage benefits through VA. If you'd like to learn more, contact your PCP or reach out to the Infertility Care Coordinator at 608-256-1901, extension 18584. Again, that number is 608-256-1901, extension 18584. We're here to help you take advantage of those benefits. Next, Dr. Rachel Mays, our women's health pharmacist, has some updates on menopause resources.
Thanks, Tammy. Did you know that the Madison VA offers comprehensive perimenopause and menopause medication management services for women veterans? If you've been struggling with bothersome hot flashes, night sweats, flushing, vaginal dryness, pain with intercourse, and more, please know that you do not have to manage these symptoms alone. There are interventions that can help. The Madison VA offers a variety of interventions for management of perimenopausal and menopausal symptoms, including medication management like hormone replacement therapy, non-hormone replacement therapy, and vaginal estrogen, as well as non-medication interventions, which may include things like pelvic floor physical therapy, hypnosis for menopause, and cognitive behavioral therapy for menopause. If you are interested in learning more or discussing your symptoms further, please consider sharing your concerns with your primary care provider. They can help guide you to the most appropriate follow-up care. We look forward to being part of your menopause journey and hopefully offering meaningful quality of life improvements as you navigate your unique menopause transition.
Thank you, Dr. Mays. Our next speaker is Sarah Rogers, providing information on our whole health resources.
This is Sarah Rogers. I'm a social worker and the Whole Health System Coordinator here at the Madison VA. As we step into a new year, it's a natural time to pause, reflect, and think about how we want to make the most of the months ahead. One of the most powerful ways we can do this is being intentional about our own well-being, because when we take care of ourselves, we're better able to focus on what matters most in our lives. Two areas we often hear veterans want to focus on are moving more and managing stress, and for good reason. Both can have a big impact on our energy, our mood, and how we show up for ourselves and others. The good news? You don't have to do it alone. It's easy to connect with communities of veterans who have the same goals through our classes. We have a variety of movement classes for all levels of ability. Whether you're looking for something gentle like seated yoga or seated Tai Chi, or you're interested in standing or mat-based classes, we have options. We also offer GeroFit, a great program for older veterans who want an engaging, social, and evidence-based approach to regular exercise. When it comes to stress, mindfulness and meditation are powerful tools. We offer a 6-week class called VA Calm, where you can explore different mindfulness practices and find what works best for you. We also offer iRest, a deeply restorative practice base that helps bring the body and mind into a balanced, healing state. So if you're looking for support, connection, or just a fresh start with your wellness goals this year, we're here for you. To get started, give us a call at 608-256-1901, extension 12537, and ask for an introduction to whole health. Again, that is 608-256-1901, extension 12537, and ask for an introduction to whole health. And if you've taken one of our classes before, come on back. We'd love to see you again.
Thank you, Sarah. Next, Ann will provide us with updates on Strength and Recovery VVC group, and we will be offering soon.
Hello, I'm Ann Buchwald, the Women's Health Care Specialist at Madison VA. I am excited to announce that we will be relaunching our Women's Health Care Support drop-in group called Strength and Recovery. In this group, we will be supporting recovery from struggles related to mental health, substance use, medical issues, or anything else that impacts personal wellness. This group will be using our VA Video Connect platform. This does require a computer, tablet, or smartphone to access the internet. Strength and Recovery group will start on Wednesday, March 4th, and run from 2 p.m. to 3 p.m. And we will run this for 8 weeks. We will discuss recovery tools for everyday use, socialization, boundary setting, technology detoxing, and more by reading various articles, sharing lived experience, and learning different coping tools that have worked for those in the group. For more information, please contact Andrea Bailey at 608-509-2598. That number again is 608-509-2598.
Thank you, Anne. That sounds like a great group. Our next update before taking some calls is on advanced care planning groups. Have you ever thought about planning your medical wishes but weren't sure how to start? Madison VA is here to help. We offer advanced care planning group sessions every month at several locations. These sessions are a great way to think through your wishes for future medical care, learn how to choose a healthcare agent, get help completing a power of attorney for healthcare or a living will. You can join us at the Madison VA Hospital or at our clinics in West Madison, Beaver Dam, Rockford, and Janesville. If you'd like to sign up, just call our social work department at 608-280-7085. Again, that number is 608-280-7085. Let's go to a few questions from all of you now. To ask your questions, press 0 to speak to one of our operators. All right, looks like we have Connie on the line. Connie from Freeport, what question do you have for us tonight?
Yes, I had a complete hysterectomy about 40 and was put on replacement until about 50-some years old, then taken off. Then with dryness and hurting down there, they put me on a replacement vaginal tab that I take, and that has helped, but I haven't had any changes or lookups or anything in the gynecology since then, just going through my primary care. But what I'm wondering is, everybody's talking about the menopause belly. I've got that. I know hormones are mixed up within me, and my PCP just says, no, there's nothing further to look at. Is there going to be something that can be done as a deeper dive to this? Because I know I've seen some chiropractors at times that have done deeper dives into hormonal things or spit tests, or I'm reaching now, but do you know what I'm saying? Plus, I have another question from last month that never got answered.
Hi, Connie. My name is Rachel. I'm a pharmacist practicing in women's health. Thank you for your question. I appreciate you sharing your concerns. In the interest of trying to maintain your privacy, I'd love to connect with you offline about maybe what your journey has looked like so far, and then perhaps we can work together to determine if there might be some more specific interventions, hormone replacement or otherwise, that might be helpful to you. I would encourage you to please leave your contact information with the screener along with your question so that I can reach out to you. Alternatively, you can leave me a voicemail at 608-280-7209. Again, my name is Rachel. My last name is Mays, M-A-Y-S. If you ask for me by name, I'll be able to get a message sent my way and would be happy to reach out.
Thank you. You want my other question?
Yes, that sounds good. What other question do you have?
Last month I got cut off, but I had sent in 2 questions, but they didn't get back with me. And the only one I can remember is, why in Freeport at the small clinic here, there are 2 doctors. Why is one of the two only take women? Why is it not, you don't have a choice this way? So if you're having troubles with one, the other one won't accept you.
Right. Thank you for your question. This is Dr. Amy Walsh from Primary Care. And unfortunately, we do only have that one full-time women's health provider. However, we do have some floats that can go to Freeport who are trained in women's health, and you could definitely see one of them.
But what I'm saying is for primary care, if you have a satellite or whatever you guys are calling them now, there's initials for everything, little places. Why is it that one of the doctors will only treat male, unless it's an emergency to get in for a cold and she's on vacation? But why does the VA allow it to be only one when you're such a small source?
Yeah, Connie, I really do see your point, that only one provider is particularly trained in women's health issues. We do have a new policy in primary care that any new hire will be seeing women and will be a women's health provider. So as time goes on, you will see less and less of this.
All right. Thank you.
Thank you, Connie. Next up, we have Jess from Columbus. Jess, are you there?
Yes.
Hi. What question do you have for us tonight?
I have a question about coverage of GLP-1 medications for weight loss and diabetes care and other things. I understand that VA has allowed some coverage for folks who have diagnosed diabetes or a BMI score of like over 30, or maybe some sleep apnea, things like that. But for folks who don't fall in those categories, will there be an expansion of coverage coming up?
Hi, this is Dr. Amy Walsh again from Primary Care. I guess, have you talked to your primary care team, either the provider or the pharmacist, about specific criteria already?
Yes.
Okay, you have. Okay. As far as I know, there are no imminent changes to the GLP-1 policy, but I would recommend checking in periodically with the PAC team to see if things have changed, because they do change pretty often. Did that answer your question?
Yes.
Thank you.
Thank you, Jess. Next, we have Linda from Freeport. Linda, are you on the call with us?
Yes, hi. Thanks.
Hi, what questions do you have?
I always start off with a good thought. Thanks, everybody, for being there. Hi, Christine. We really appreciate this. So my question is, the status of our new Freeport CBOC, when will that be opening, possibly, and where will it be located? Do we have any updates on that?
Hi, Linda. This is Abe Rabinowitz, the Associate Director. I do have a couple of updates. We are very happy to report that the lease build-out for the new Freeport Clinic was awarded at the end of the last fiscal year, so towards the end of September. We're right now working actively on the design of that new clinic. I don't have the exact address for you right now, but I can tell you that it's on Galena Avenue on a corner. It'll be a renovation of an existing building. It's about 2 miles from the current clinic. Oh, do you have the address?
I know where it's going to be, though.
Oh, there we go. So if you can describe that, that'd be great.
Linda, this is Ann Buchwald, the Women's Health Peer. And I will reach out to you and tell you exactly where the clinic is later, because I know the corner that you're talking about. I just can't give you a direct address right now.
Yeah.
Sure. We hear all kinds of scuttlebutt, and I just thought, well, with the resource we have with this phone call, I'd ask. But it's a great thing because we definitely need one. So I appreciate that, Ann. Thanks, Abe. But
Linda,
I do have
I'm sorry, just when we don't have an exact date that it will open or when the construction will be done, but that's a question you can keep asking in forums like this, and we'll look to update veterans as we have more progress on the clinic and we actually start that construction. So thanks for the question.
Well, thank you for the answer too, and that. So I have one more I want to sneak in. I didn't quite understand Connie's call from Freeport. What's the deal with having only one physician for the women? Is that always been the practice? I don't get it. So we have a PA out there and a regular doctor. Couldn't we have the choice to go to who we want to?
So, yes, good question. So there's an NP who sees female patients, and there's a doctor there who generally sees male.
Right.
Now, if you really want to see the male provider, the doctor, you certainly could get assigned. He just wouldn't be doing any of the pelvic exams, those kind of things.
Oh, sure. I get it now. Okay, I just needed some clarity on that. I think they're both great out there. I have no issues with either one of them, nor the whole clinic, because they do a knockout job.
This is Tammy, the Women Veteran Program Manager, and we generally have 2 women's health designated providers at each clinic. It's just Freeport is really small right now, so we only have 1 women's health designated. That's where they have quite a bit more education and knowledge for taking care of our women veterans, so that's why we generally keep most of our women veterans with a women's health designated provider, but you do have the option to see any provider that you would like.
Yeah, and this is Dr. Martian. To be clear, the training for all the providers in their residencies, et cetera, covers women's health issues. It's just we do additional training here within the VA, so they certainly can take care of you.
Let's do one more question before we go into some more updates. So we have Tina from Sun Prairie. Tina, what question do you have for us tonight?
I am wondering if the chiropractic care is going to expand to the Sun Prairie East Clinic.
Hi, Tina. This is Sarah Rogers. I'm a social worker, and I'm with the Whole Health Program. The short answer is no. We don't have a roadmap for that in the immediate term. And the longer answer is I've heard that question from many veterans. It's an excellent question. It's a beautiful clinic. It really is great access. So I appreciate you raising the question because this helps us inform future decisions.
Okay, yeah, because I love Dr. Luke, and I love going to him, but that drive to the west side is so stressful.
No, I hear you. The Beltline is not my favorite way to spend my time either.
Okay, well, thank you.
Absolutely.
Thank you, Tina. Thank you, everyone, for the great questions. Our next update is on some training sessions being developed. We are excited to announce that we're developing a Women Veteran Self-Defense class in partnership with Women's Health Program. These sessions will be offered twice a year and will include risk reduction strategies, hands-on self-defense, and simulated exercises. Our police chief and one of our officers, both women veterans with self-defense training, will help lead this initiative. Stay tuned for upcoming dates and locations. One way to receive updates on this is by signing up for email updates if you haven't already. All you have to do is go to our main Madison VA Hospital website, scroll to the bottom of the page, and subscribe to Madison VA Healthcare News and Announcements. You can sign up for all our Madison distribution lists. Next, we have details on our new Fisher House location. We have some exciting and highly anticipated news that you may have heard. We were able to acquire land for a future Fisher House. We have been working with local officials, the Fisher House Foundation, and Fisher House Wisconsin, and we couldn't be more excited to have this resource available to veterans in the near future. For those unfamiliar, Fisher Houses are a home away from home for military and veteran families traveling from out of town looking to care for their veteran receiving care at or coordinated through VA. A Fisher House eliminates the burden of paying for hotel rooms, meals, and other essentials needed for an unknown amount of time while a family is acting in a caregiver role for their veteran. Since land was unavailable on the Madison VA campus, an off-site solution was needed, and we've secured land for the future site at the northeast corner of Nursery Drive and Deming Way in Middleton, Wisconsin. We'll join 100 existing Fisher houses around the world, including Milwaukee and, most recently, North Chicago. The housing facilities are built through private funds, grants, and donations through the Fisher House Foundation. The next phase is finalizing permits and site preparation by VA before turning it over to Fisher House for construction of the 16-unit house. We hope to build ground in 2026. It was a long wait. It took the work of many people to get it thus far, but when it opens, there will be a lot of opportunities for community support, and we can't wait for you to see it. Our next speaker is Jennifer Johncox, our Suicide Prevention Coordinator.
Hello, this is Jennifer Johncox with Madison VA Suicide Prevention. Preventing veteran suicide is a top clinical priority for the VA. One of the ways we can do this is by increasing the time and distance between a person in suicidal crisis and their access to lethal means. The VA Keep It Secure program promotes awareness about the simple steps you can take to protect yourself and your family. You can find information such as how to secure firearms, safe medication storage, as well as support for veterans and families who are experiencing a suicidal crisis. Find more information at www.keepitsecure.net. That address again is www.keepitsecure.net. In addition, we provide cable locks for veterans and the community free of charge. If you are interested in cable gun locks, ask at the clinic next time you are in, or you can request them through your primary care team. As always, veterans can reach out to the Veterans Crisis Line for free confidential support 24/7. You can reach the crisis line by calling 988, press 1. Again, that's 988, press 1. Texting 838255, or by using the chat feature online at the veteranscrisisline.net chat. This information again is by calling 988, press 1, texting 838255, or by using the chat feature online at the veteranscrisisline.net/chat.
Thank you, Jennifer. Our final update is on our Sister Assister program. We're proud to offer a special program just for women veterans called Sister Assister. This program is all about support and connection. Our women volunteers help fellow women veterans get from the front door of the clinic or hospital to their appointments. And if you'd like, they can even stay with you during your appointment for that extra bit of comfort. Right now, we're looking for women veterans who want to volunteer as Sister Assisters. It's a wonderful way to give back and make a difference for other women veterans. If you're interested, please leave a message after this call or reach out to Tanya Salas, our Sister Assister Coordinator, at 608-256-1901, extension 18584. Again, that's 608-256-1901, extension 18584. And if you'd like to receive Sister Assister services for your appointment, we'd love to help. Just call 608-256-1901, extension 13440. Again, that's 608-256-1901, extension 13440. When you call, you'll be asked to leave your name, the last four of your Social Security number, your phone number, and the date, time, and location of your appointment. Please give us at least 7 days' notice so we can make sure a Sister Assister is available for you. Let's go back to some questions from all of you. We have Angela from DeKalb, Illinois. Angela, what question do you have for us tonight?
Okay. Well, like I said, I got my hearing aids back in actually 2022 because I lived in Tennessee, but then in 23 I moved up here, and I made my appointment at the Rockford office, and they checked my hearing aids and my hearing and everything, and it was real well, but I don't know whether maybe my ears are falling again, or it seems like here at my house, I'm the only person who lives here, and I don't, have real loud things around, and I do need to wear my hearing aids every day or all the time because otherwise I miss things. But I noticed that even watching TV, sometimes my ears just don't catch the words or the whole sentences, and it's like I'm catching a word here and there and kind of reading the lips. And is that normal? I know I was told that I will never, hearing aids will never be like having your own regular ears. But is that normal to experience this?
Hi there, Angela. This is Dr. Amy Walsh from Primary Care. I'm wondering when the last time you met with audiology was.
See, like right now, I didn't hear very well what you said.
When was the last time you met with audiology?
Oh, the last time was, I think it was in July. I was looking through my calendar, and I had an appointment that day at the VA at 8:30, and that was July the 11th.
Okay. I recommend checking back in with audiology. They're very happy to see people to do a repeat hearing test if they think that's indicated. They can also do a lot of troubleshooting with the hearing aid. So I think the next best step would be to talk with audiology again.
Okay, and I also know that, they say, well, they have a volume and this and that, but I am so scared to change anything because I say it's like right now they're stable, and then if I change it to lower or higher or whatever. So what I do, usually, like I go to my grandson's basketball games, I just don't wear them, in loud places like that. And so, okay, so do you because they told me the last time I was there, they said, oh, you're okay for about 3 years. And I thought, oh my God. Well, I was real happy, but like I said, so do you think that I should make another appointment?
I do think you should make another appointment with audiology to see if they have any more tricks up their sleeves.
Okay. Well, thank you. I appreciate your help very much. I really am happy at the VA for this.
Thank you for your question.
And Angela, if you could leave your phone number at the end of the call on the voicemail, we'll reach out to help you, to assist you too. So if you could please leave a voicemail at the end of the call with your phone number and contact information, we'll give you a call later. All right, next up we have Mira from Reedsburg.
Hi, this is Myra from Reedsburg, and I have a question about the eye clinic. See, because recently I had eye surgery done to remove a cataract, and I'm just wondering how come I get the surgery done in Baraboo at the hospital. I get all my post-op exams also at the hospital in Baraboo, but why can't I order glasses through the hospital up here in Baraboo? I go to the Dean Care Clinic, eye clinic. Why do I have to go and take my prescription all the way down to Madison and having to wait to see somebody to get my prescriptions filled? And then I have to turn around and wait another month to get my glasses. But instead of going down to Madison and picking my glasses up, they send the glasses out to me because now I live in Reedsburg before I lived in Baraboo. And why can't I just go ahead within 2 weeks after I order my glasses that I get them and I have to pick them up at the clinic? Why can't I do that?
Hi, Myra.
Why can't?
Yeah, thanks for your question.
And why can't?
So this
Go
is
ahead.
Dr. Walsh again from Primary Care. So the Baraboo Clinic actually is just starting a pilot where they do eyeglass fittings. So now, once you get your prescription, you can just take it, you can call the clinic and schedule an eyeglass fitting, and one of the nurses there will do the fitting for you. You won't have to travel down to Madison VA Hospital for that.
To the VA hospital to order them. Why can't I just order them up here at the clinic that examines my eyes?
Oh, you mean with your community care provider?
Yes.
It's just a policy we have, unfortunately. But I do encourage you to take advantage of the Baraboo Clinic eyeglass fittings. I think that will be more convenient for you.
Yeah, this is Melissa from Community Care, and all equipment comes through the VA. So whether it's glasses or hearing aids, the testing can be done in the community if you are community care eligible, but that equipment all comes through the VA. It's just the way the VA is set up currently. But yeah, you could reach out to the Baraboo CBOC and get your eyeglasses there. That's a great pilot program.
All right, thank you, Myra. Next up, we have Brian from Madison. Brian, what question do you have for us tonight?
Hi. I'm a transgender veteran that has been receiving HRT through the VA for several years, and with all the stuff that's been happening recently, with increased restrictions and trying to restrict federal funding for gender-affirming care, I'm wondering if there have been any changes or if there's anything proposed that would mean that I would have to go elsewhere for my HRT.
Hi, Brian. This is Dr. Marsh. I'm the Chief of Staff here. So, yes, so as long as you were receiving your hormone replacement therapy prior to January of this year, as it sounds like you were, then you are still able to receive that from us, and we have heard nothing that has changed.
Okay. Thank you.
Mm-hmm.
Thank you, Brian. Next up, we have Nancy from Winona. Nancy,
hello, I just want to thank...
Oh, go ahead. Thank you.
Yes, I just want to thank you guys for creating this forum. And I wanted to say I've had great care from the VA. I'm a relatively new to getting care from the VA in the last, year. But when I've been on hormone replacement therapy, estradiol patches, and I get 2 other medicines, the progesterone and magnesium glycinate to help me sleep. Anyway, the medicines that I get from the VA are not very good, and I'm going to explain 2 of them. With my patches, they're about 4x4 circular. The ones I get on the outside through TRICARE and pay a little bit of money for are tiny. They're about 1/10 the size. These patches that I get from the VA, they fall off. After a day, they say, put them back on and press hard. They still fall off. So I have to use 2 to 3 times the amount. They're huge. They're uncomfortable. And with the magnesium glycinate, they gave me magnesium pills, and they want me to take 8 tablets instead of 1 capsule of magnesium glycinate. This is what I mean when I talked to my provider about it in La Crosse. They put me in front of them through to the pharmacy, and the pharmacy said there's nothing I could do. There should be something I could do because, yes, you can give me supplies, but they're highly inadequate. So I've opted to fund it myself because I can't use things that are highly inadequate. I can't take 8 capsules, and they don't even have the glycinate in them, and the other ones are huge. So that's my concern. Yes, you're offering things, but they're not very good.
Hi, Nancy. Again, my name is Rachel. I'm a clinical pharmacist that works in women's health. Thank you for expressing your concerns. And I'm sorry to hear it sounds like you're having some difficulty with some of your medications that are supplied through the VA. I do want to reassure it certainly is your option if you want to purchase medications independently outside of the VA. However, there are some alternative formulations of hormone replacement therapy that we can offer, which may include an alternative type of patch that could be of interest. Additionally, happy to discuss if there are other concerns that we may be able to help address, but did want to at least let you know that we do have other formulations available if you're interested in further discussing. I would encourage you to leave your contact. Oh, I'm sorry, excuse me.
Yeah, it's just that you're at an appointment, they call the pharmacist, you talk about this. That's not what we're being told in the field. You're being told you use that or, go get something else. And it's not good care. If you're giving care, you need to give like care, similar care that you get to the outside. So similar patches, similar pills.
Thanks for expressing those concerns, and I agree. Again, Nancy, I'd be happy to chat more offline if it's of interest to further review more of your specific concerns and try to help offer more personalized care if that's of interest. You can feel free to leave your contact information with the screener. You can also reach out directly at 608-280-7209. Again, you can leave a message for me. My name is Rachel. My last name is Mays, M-A-Y-S, and I'd be happy to get in touch with you. Thanks again for your questions and concerns.
Thank you.
Thank you, Nancy. Next up, we have Ada from Davis Junction.
Hi, my name is Ada. I'm calling from the state of Illinois. I want to thank you for the wonderful job you guys do in the Rockford office. However, I don't know who I need to talk to and who could help me with my questions. My husband was a 100% disabled veteran, Vietnam veteran. He died in 2024. Ever since he was attending Rockford, I was trying to get an ID. I am also a Vietnam veteran. However, I am not disabled. So for years, I was trying to get a veteran ID. I called one of these numbers they gave me, and they told me to go to the internet and get an ID. I applied. I didn't get it, and due to my husband's illnesses, I just took care of him. I was his caregiver for 2.5 years. He died in 2024. It took me until 2025 to go to Rockford to ask, how do I get an ID now that he's gone? They told me I needed to call, Washington, the VA website. I called and they sent me a form. It says veterans applying for veterans benefits. I said, why do I have to apply when I'm also a Vietnam veteran? They told me I needed my husband's medical records. Why do I need a year of my husband's medical records for me to get benefits? What do I need to do? I need help with someone to help me to get my veteran ID because I am incurring a lot of medical bills. I am going to be 79 this year, for goodness sake. I had an accident a month ago, and I have a broken knee. I am going to private doctors. I am paying for deductibles of the yen. I need service from the Veteran Administration in Rockford. I don't know what to do.
Ada?
Yes.
Hi. My name is Christy. I'm one of the supervisors in the Eligibility and Enrollment Office here at the VA in Madison.
Yes.
I'm going to give you my direct number to give me a call tomorrow.
Sounds like there's a lot of pieces and components to this whole situation. So
Yes.
I'd like to get more information from you and have a more one-on-one conversation.
Yes.
So give me a call tomorrow. My direct number is 608 256
256
1901.
Okay.
And my extension is 11920. You can also leave your name and number with the screeners or leave a voicemail at the end to double up on all of that, and and we'll get in touch with each other, okay?
Okay. So I received from this office, I received a form that I need to put down how much I get, how much is my, because of I don't know why I have to give all this information when my husband was getting the benefits. And I tell you, I am very proud of the Veterans Administration and the services. But when it comes to me, I cannot even get an ID. And they sent me to Madison. I forgot the name of the place, to go and get my ID. But everybody now is telling me I need my husband's yearly medical records because he passed a year ago. That is crazy.
Yeah, and I'm not sure what that kind of comment is being in regards to, so that's why I think it'd be best for you to give me a call. I'm just going to repeat the number one more time, and it's 608-256-1901, extension 11920.
All right, thank you, Ada. We've got Sherry on the line now from Stoughton. Sherry, what question do you have for us tonight?
Hi, I just want to reiterate, thank you so much for doing this. But my question is, will there ever be, clinic hours that go past 4:45? Even, once a week? Because I really hate to take time off to go and see, a doctor when I'm like, oh, man.
Hi, this is Dr. Marsh. I'm the Chief of Staff here. So this is always something that we're exploring. There are some clinics that do run late, but we absolutely are considering that. So more to come on that.
All right, thank you, Sherry. Next up we have Elena from Madison. What question do you have for us?
Is this for Alana from Madison?
Yes.
Oh, sorry. I couldn't hear because there was a beep, so I wasn't sure if it was for me or not.
Sorry about this.
Okay. My question is whether VA offers GLP-1 drugs for weight loss or weight management, like Wegovy or Ozempic.
Yeah, thanks for your question. This is Dr. Walsh again from Primary Care. We do offer GLP-1. We offer Zepbound. We offer Ozempic. There are specific criteria for them. If you're interested, I would talk to your PAC team, and they can talk about the specific criteria. You do have to be following with the nutrition department, so if you haven't done that recently, I'd suggest starting there.
Okay. I think I read online that maybe you have to be overweight, but also have some type of, maybe be pre-diabetic or something like that. Is that what you mean by the criteria?
You really only need one weight-related criteria, and the list is long.
Okay.
High blood pressure, diabetes, even knee, ankle, hip arthritis.
Oh.
As a weight-related condition.
Oh, okay. Well, that's great news. I will follow up with them then. So nutrition, is that the person that people that I would want to contact first?
Yeah, ask for a MOVE consult. That's the name of our nutrition
MOVE.
program.
Okay. Okay, and then I have another question about HRT. I had spoke with my primary care physician quite a while back about trying to get some HRT, and I was sort of just kind of like shut down. I don't know if that's changed by now, but do you offer anything other than a patch for HRT?
Hi, Alana. This is Rachel, pharmacist practicing in women's health. Thanks for your question. In short, yes, there are a variety of different types of hormone replacement therapy and non-hormone replacement therapy that can be considered. I would encourage you to leave your contact information with the screener, and I would be happy to reach out to discuss in a little bit more detail what symptoms you're experiencing and what treatment options may make the most sense for you personally. Additionally, you're welcome to call the Women's Health Clinic at 608-280-7209, and you can ask for me. Again, my name is Rachel. My last name is Mays, M-A-Y-S, and I'd be happy to connect with you to talk about first steps.
Okay, great. Thank you.
You're welcome.
Just a reminder, if you want to be contacted by one of us or need to leave your contact information for us to contact you, please leave a voicemail at the end of the call. You won't be able to get back in sync with the screeners, yes, thank you, with the screeners, as you'd have to call it, press 0 and get back in the loop. So please leave a voicemail at the end of the call. Next up, we have Diane from Freeport. What question do you have for us tonight?
I'd like to know, first I'd like to say hello. This is my first time. I recently just moved back to Freeport. I got hooked up with a mental health person that I talk with, and I've been with that person for almost a year, and then they ended up moving, and now I got to talk to someone else. Seems like every time I get a mental health professional, they end up going away, and I end up having to start all over with somebody new, and that kind of bothers me a lot. So are they going to try to keep more permanent people in place?
Hey, Diane. This is Sarah Fraser from Mental Health. I'm one of the clinical social workers here. I really appreciate your feedback on that, and I definitely understand where you're coming from. It is hard to open up and build rapport with someone, and then to have that switch is really tough. It is definitely something that we're always looking at, and we want continuity of care for you, and we understand how important that is. So I really appreciate your feedback. I would encourage you, if you're having issues right now with like goodness of fit, or if you are looking for a different provider or to establish with a different provider, I'm not sure the specifics of the situation, but I would welcome you to call our clinic, which is 608-280-7084. Again, 608-280-7084, and we can discuss that as well and kind of see where you're at. And also, I appreciate you calling and giving the feedback, and I will also share that.
All right, thank you, Diane. Next up, we have Elizabeth from Sycamore. Elizabeth, what question do you have for us tonight? Elizabeth, are you on the call with us still?
Yes. My apologies. I always keep things on mute. It's an old habit of mine. But
No worries.
my name is Elizabeth, and I just got service connected about a year ago. I'm at the Rockford Satellite Clinic, and I wanted to know, because I know that because they have limited space, they do have limited programs. So how would I go about finding I know all the things are available to me, but with the location of where I'm at, I wanted to know what might be available there. How would I attain this information in order for me to get my health together and also get some things checked out for like my redetermination when it comes to my percentage, because I know I just found out some things that they did not put in my medical paperwork when I got out of the military, but they were documented. I just wasn't given it. So, yeah.
Hi, Elizabeth. My name's Ann Buchwald. I'm the Women's Health Peer Specialist. You can find out a lot of those things through our VA Introduction for New Patient Orientation, which is the fourth Mondays of every month. You can go to our Madison VA website to look up that information. I am also available at the Rockford Clinic tomorrow if you have some time to come in and see me. You can reach me at 608-509-1431. Again, my number is 608-509-1431, and I can help you answer some of those questions.
That's all the time we have for questions today. If we didn't get to your question, please stay on the line because in just a moment you'll have the chance to leave a voicemail with your questions, comments, or feedback. We plan to get back to you with a response within the next several weeks. Thank you for joining our Teletown Hall. Have a great evening.